Yeah. So James, like I said, I'm really happy to finally connect with you in person, and I guess we first connected in Instagram, and I started following you because the posts or the content that you provide is actually of really high value, and I started looking into your work and started subscribe to your YouTube channel, and I just found that everything that you provide is of high value, and I'm just really fascinated. First of all, and just want to ask you, how did you start your career? How did you get into your current field? What sort
Well,
of,
very good
caught your
question.
attention? Yeah.
Well, very good question. I have been a dentist for many years, but
Hmm.
because of a lot of government intervention, a lot of red tape and so on, I just find it too stressful to manage it. So I
I
decided to
see.
quit industry. And I've been suffering from back pain for a long time. There was a course for personal training starting at the college, and it was free of charge. So I thought,
Uh-huh.
why not giving it a go? And then I found the body to be so fascinating, and getting to know exercises better, helped me to do my own exercises as well, and to avoid
Great.
injury. So
Uh-huh.
I've been suffering from a lot of injuries from the past. So knowing the exercises in details helped me to avoid injury. And after I've acquired all this knowledge, I'm trying to share it with other people.
Mm. Fantastic. And how long have you been doing this?
Well, I've been doing this for 2 years, and in the meantime, I've written a book on lower back
Aha.
pain,
Oh,
helping people to manage the, their own back pain. Because when I had my back pain before, nobody was able to offer me any conclusive help.
uh-huh.
Nobody was able to offer me um, any substantial advice. I mean, the advice was contradictory. I mean, some people said you should rest, and some people say you should use take painkillers and so on.
Right.
So yeah, so I've been doing a lot of research on that, and I realized that it is the trigger point which is causing the problems.
I see. I see. Well, I guess on that note, then, what are the, what is a corrective exercise specialist? Because I see that on your title. So can you give our audience a little bit of a summary of what a corrective exercise specialist is and what they do, and who do they treat?
Well, basically, say for example, if you suffer from a certain type of injury, okay,
Hmm.
then from certain type of corrective exercises to reverse the situation. Let me give you an example. People who suffer from uh, like a kyphotic posture, round
Hmm.
shoulder,
Hmm.
forward head posture, causing a lot of neck pain and shoulder pain. What you can do is to reverse that posture by opening up your chest, strengthening your upper back, stretching the chest out. Those are the corrective exercises that we can do. So in the first place, we have to actually assess the patient and find out what the condition is. Is it a
Uh-huh.
structural problem or is it a muscular problem? If it is a structural problem, then they have to seek medical advice, such as going for MRI scan and so on. So we need to do assessment for the patient to find out what causes the problem in the first place, and then we can actually address the problem.
I see.
accordingly.
So yeah, so you treat your patients in person, or are you treating people via video calls like this as well? Because I understand, with the whole COVID-19 situation, it's getting a little bit tricky with the face-to-face
Absolutely.
interaction.
Yeah, I'm not actually working because I've been working so many years as a dentist.
I see.
I decided to take a rest, for a couple of years before I decide what to do. I've treated a lot of friends and colleagues and so on, but haven't actually treated strangers from outside. But
Fair
I,
enough.
I do give people advice on Instagram, free advice on Instagram as to how they can deal with the back problem. A lot of people actually ask me, "Oh, I got back pain. How can I deal with it?" I wish that is as simple as that I can give you one straight answer, because there's so many different causes of back pain. There's not just one cause; it's multifactorial. So we need to establish what the cause is in the first place before we can actually treat the patient.
Yeah, yeah. So what are some of the most common ones that you get? What are the most common questions that you get from your followers?
Well, the majority of people have back problems mainly through incorrect exercise strategies. Say, for example, when they do deadlift, they bend the back and they're
Mm.
utilizing the wrong muscle for the lift, and as a result, they strain the back,
Uh-huh.
formation of trigger point, and then back pain. But all this basically result from poor posture in the first place.
Hmm.
So they become vulnerable to this sort of problem because of poor posture in the first place.
Right, I see, I see. And do you feel and do you believe that posture is something that's taught, or is something, or is it something that somebody naturally, born with? Because yeah, the reason I ask is this because I've taken some acting classes just out of interest, and one of the first lessons that I had is all about posture, and how posture affects mood, how posture affects the way you perceive things, and you act out with your bodies, affects your body language. So I'm thinking, well, so my question is, are people born with a certain type of posture, or is it taught? And if it is taught, then how can they practice it, and how can they improve on it?
Well, very good question. Actually, we are not born with poor posture unless you're talking about the structural problem like scoliosis, or some people who are born with structural kyphosis, like
Hmm.
born like that. They are structural problem, but we actually deal with musculoskeletal problem, which is resulting from poor posture. I think it is prevalent these days because we work in front of the computer, curving forward, and
Mm.
also we sit, we sit with a hyperextended back, causing anterior tilting of the pelvis. People, say, for example, wearing a heavy bag on one side, causing um, structural scoliosis, and
Hmm.
also people who wear high heels, causing hyperextension of the spine and anterior pelvic of the pelvis as
Yes.
well. The real main culprit is prolonged sitting, which causes prolonged tightening of the hip flexors.
Mm. Yeah.
That is the
Yeah.
main problem,
Yeah,
actually.
yeah, and that's very common with probably 70% of the workforce.
Well,
Um,
more than that, actually, more
More
than
than
that.
that.
I
Yeah.
actually observed that, I would quite confidently say more than 90% of people got hyperkyphosis or forward head posture, because
Uh-huh.
sometimes when I'm walking around, I see people, very few people actually walk with upright posture. The
Hmm.
majority of people have curved forward shoulder. And if you think about it, I mean, if you just stand up and try to actually relax your hand,
Yeah.
just see if your fingers are pointing inwards or pointing forward. I
Right.
think the majority of people have the fingers pointing inwards. That actually reflects the internal rotation of the
Of
shoulder.
the
I
shoulders.
mean,
Hmm.
what we should do is to externally rotate the shoulder and then have to fit. Naturally speaking, the thumb will be pointing forward, but the majority of time we don't do that.
Uh-huh.
Shoulder get roll in. That is hyperkyphosis in a way.
Uh-huh. And
Yeah.
this is caused over a long period of time.
It's very minor hyperkyphosis, but as a result of that, that can reduce the subacromial space, and that can predispose to rotator cuff injuries.
I see. And this is developed over a period of time. It's not something that happens.
Because of prolonged protraction of the shoulder
Hmm.
over time. So
Hmm.
we become habitually, our shoulder become habitually rounded as a
Uh-huh.
result of the postural deviation or our postural habits.
Yeah, right. Okay. Does it come a point where it becomes irreversible?
Well, it becomes irreversible only when it becomes structural. When it is
Hmm.
only musculoskeletal, you can reverse the situation by strengthening your back and
Hmm.
opening up your chest by stretching your chest, like
Hmm.
anterior pelvic tilt. Say, for example, people who got anterior pelvic tilt, which is very, very common. I mean, I got that. So what you need to do is to consciously correct that by tightening your glute and tightening your core, and that will
Uh-huh.
help.
Uh-huh.
Yeah, because
Yeah.
I got a guy actually who played golf and asked me, "Oh, I got very strong glutes, but yet I still got anterior pelvic tilt." Yeah, I think that is because of the fact that he must be sitting for a long time, causing tightening of the hip flexors, and he may be
Yeah.
flat because flat foot can also cause internal rotation of the knees and
Yeah.
compensate anterior tilting of the pelvis.
Yeah, yeah, for sure. Well, I've got flat feet, so I wear orthotics.
Those people got flat feet these days because our
Yeah,
feet are designed to walk on soil, not on flat concrete
on concrete
floor,
floors.
or
Mm.
because the wood floor doesn't support our arch. So over time, although we are not born with flat feet, but because we're walking on flat ground like that, they're not
Mm.
supporting the arch. Eventually, the arch will collapse and become flat-footed.
I see. Oh, that's very interesting. So I guess it's very important for children to have the proper support then, proper feet
Yeah, yeah,
support. Yeah,
yeah.
as a
If
growing.
wear with proper support of the arches,
Hmm.
and that
Hmm.
will help. And
Yeah,
the identification of the problem is very important as well. If you identify this problem early, then that will avoid further down. a problem further down the kinetic chain, because anything happen to the feet can affect all the way up to our body, through the lower back to the shoulder and the head.
Yeah, for sure. Well, unfortunately, I picked up a little bit late. I only started wearing orthotics when I was 17, so a little bit too old, unfortunately. But yeah, but look, that's really fascinating. So, what are some of the things that people can do to correct these poor postures? Something that they can do at home. What are some of the remedies that you could recommend?
I actually wrote a book for dentists, about how they can correct their posture, because dentists, always crouch forward when they treat the patients. The head is forward. So it is very important that you recognize what ideal posture is. So sometimes, what you have to do is to consciously correct your posture. I mean, I'm very conscious of my hand when I'm walking. I'm thinking, oh, my fingers are pointing inwards. So what I need to do is consciously rotate my shoulder out and maintain that position.
Yep. So well, can I ask you so what is the ideal posture? Because I've heard a lot of debates, right? You've got the military posture, for example, and then you've got the ballet dancers. Well, that's what I mean. And you've got the ballet dancers posture. So, there's a lot of people with different opinions. So what is an ideal posture?
Well, let me just explain to you what posture is. Posture is the position that we adopt ourselves during the day. With the normal spine, there is a curve down there called a lordosis. This is called thoracic kyphosis, and there's a cervical lordosis. Those are natural curves, when they're in an ideal position, the spine will support each other, the bony element. When they are put out of position, then we rely on ligaments to support the spine, and that can ultimately cause injury. There is a small curve there. There's a small curve there that is called the natural abdominal lordosis. What you need to do is to align yourself against the wall. If you can actually put your hand through it, you got hyperlordosis. You're not supposed to be able to get your hand through it.
I see.
You can get your finger through it. That is the normal posture. But if you can get more than that, then that is hyperlordosis. The other way to test is that if you tighten your glutes, in front of the mirror, standing perpendicular to the mirror, if you tighten your glute, you can actually see your pelvis tilting forward. Then you have got habitual hyperlordosis. That means you've got a habitual anterior tilting of the pelvis. Because what happened is that you should have a neutral pelvis, neither tilting forward nor backwards. But the majority of people, the pelvis is tilting forward. When the pelvis tilts forward, you get a exaggerated curve there.
I see.
And then tightening of the muscle there, weakening of the core, and that can cause a lot of problem in the long term. And it's exactly the same with the thoracic area. We're not supposed to be bending forward. We're supposed to be upright. Okay, as you say rightly, when we walk like this, it gives us confidence. When people are depressed, they walk like this because they want to hide away from people. So the fact that you walk with good posture, will also affect your mood as well, make you feel happy. Upper body is very easy to test whether you have got forward head posture, and around the shoulder is where your fingers are pointing. When you're standing facing forward, if your fingers are pointing inwards, that means you have got general rotation of the shoulder and round shoulder. What naturally should happen is that your fingers should be pointing forward. So you should externally rotate the shoulder and the fingers should be pointing forward. That is what we call natural posture.
I see. Well, that's a really great tip. And that's something that everybody can do quite easily.
One last thing is the forward head posture. When we align ourselves against the wall, the back of the head should be touching the wall. If the back of the head is forward, that means you have got forward head posture. Obviously, there are different degrees of forward head posture. I mean, some people are like that. Very obvious. But the majority of people are slightly forward, and that is not obvious. The further forward you are, the heavier the head is, and then the upper shoulder muscle and the neck muscle will have to support more weight of the head.
Makes sense.
It can lead to neck pain, also upper back strain as well.
Makes sense. So in summary, so the best way to self-diagnose your posture is to
recognize the poor posture.
The poor posture is stand against the wall. So your natural position is when you're standing, your thumb should be facing forward, and the back.
remember, but you're not rotating your wrist, you're opening your shoulder out, externally rotating your shoulder. You're not turning, you're not turning the wrist out and remain in this position. You're not doing that. Okay, what you need to do is to externally rotate your shoulder and the whole arm will be facing forward. The thumb should be pointing forward.
Okay. And you rotate your shoulder back, and then your head should be touching the back of the wall.
That's right. And with regard to the lower part, engage your core. Whenever you're doing any sort of a functional movement, even walking, jumping, absolutely running, or any exercises, you should get the core engaged. When you engage the core, the pelvis will be in the correct position.
Great, fantastic. Those are fantastic tips. Thank you so much for sharing that. I mean, that's amazing. I'm sure people are going to start going against their wall and measure themselves and self-diagnose themselves straight away.
It's harsh, I mean, if you employ somebody to assess your posture, it will cost you a fortune. You can do that yourself against the wall very, very easily. But as you say, well, the most important thing is to recognize your posture and consciously correct it. It's not something that is natural. I mean, nobody actually squeezes their butt, when they walk around. It doesn't feel natural. But that is something that you have to do, is to engage the core all the time. Because we're not switching on the core. The majority of people sit all day turning the core off, and eventually the core becomes dysfunctional. And you have to consciously activate it all the time. It doesn't come natural. It will take a long time. It took me about 1.5 years, to know how to activate my core and keep it activated whenever I'm walking.
Right. So,
sorry. The reason why you need to keep the core activated is because when you're walking, you never know when you're going to slip. You may be walking on a log. You may be actually slipping on something slippery. If your core isn't engaged, then the sudden jerk, can initiate back pain. And I had that experience all the time.
Right. Fascinating. So obviously, when you're referring to the core, it's not just the abs, not just the abdominal muscles that you're talking about. It's the entire center area.
Well, the core involves 4 areas: the transversus abdominis around there, and the pelvic floor muscle, the diaphragm, and the multifidus at the back. But when you activate the transversus abdominis, all the other core muscle will be activated. Even the glutes will be activated.
I see.
So what you need is to posteriorly tilt the pelvis slightly, and that will engage the core. But the majority of people can't do that because it doesn't come naturally.
So what are some tips that you could give people to actively engage the core at all times? What are some of the things that you do that's worked for you?
Well, if they don't know how to activate the core, it may be a good idea to try to squeeze the glutes. When you squeeze the glutes, the core is activated as well. It's easy to squeeze the glute, but to be very honest, a lot of people's glutes are inactivated either as well, because it's just the day. So you need to do is activate the glute by doing glute bridges and so on. But before you do that, you need to stretch the hip flexors out first, because when the hip flexors are tight, then the glute will not be activated.
Right.
First thing you need to do is to stretch the hip flexors first before you engage in any sort of glute activation exercises. Not the other way around. You stretch the hip flexors first before activating the glutes.
Right. Okay. So stretch first before activation. Okay.
Yeah.
Got it.
The normal protocol is that we do the trigger point first, but it's very difficult to reach the trigger point of the hip flexor, so we just do stretches. When we manage back pain, what we do is to do 4 stages. The first one is trigger point management, and then we stretch the muscles out, and then we activate the underactive muscles, and then we do the balance training, the integrated exercises afterwards.
Yeah, fair enough. So, I mean, most of most of my followers, my audience, they're white collar professionals, and majority of them are in the real estate industry and so forth. So, you're talking, specifically to those group of people. So, for I suppose for say a marketing manager, right? Who probably spends 90% of their time at the desk. What are some practical ways that they can sort of help mitigate some of those poor postures, during work, during 9 to 5? What are maybe 2 or 3 things that you recommend people to do and remember to do?
Very good question, actually. I mean, for marketing manager, the most important thing that they need to do is inspire confidence. The way to do that would be to open up the shoulder. So the finger pointing, very important. making sure that you roll your shoulder out and point forward. That will express yourself, with more confidence and give people, present yourself as being a very confident individual. That is one thing. The second thing is that when we're talking about posture, we're not talking about any particular posture that is particularly harmful. It is prolonged static posture that is harmful. Even when you're standing for a long time, that is harmful as well, because muscles are not designed to be in a static position. So the best advice that I can suggest to people is that they start to move around when they're sitting, they stand up a little bit, and change the posture from time to time. That is the main thing, and also when they are sitting for a long time, they can do some hip flexor stretches. I mean, say for example, when you're sitting, you can get your leg back and then roll the chair back and lunge forward. You can still see the screen and you can still work on things when your leg is back.
Yeah, fantastic.
Stretch your hip flexors like this. Yeah, you can stretch your hip flexors like that, and then you can clasp your hand behind your back to open your chest up.
Yeah, that's a great one. Yeah.
You can do chin tuck. Tuck your chin back, and that will deep neck flexors to prevent, prevent neck pain. So all these small tips, you don't have to go to the gym to do a full-blown exercises. I mean, those kind of exercises you can do at work.
Yeah.
It may be a bit odd, when you're stretching your hip flexors, on a chair, but they are really, really good.
Yeah, and how frequently do you suggest people do that? Once an hour, once every 2 hours, or?
Oh, too long. Every 20 minutes, you should be moving from one posture to another. Even when you're in that posture, you sit like that. That will help because you're actually opening up your chest by getting your elbow back. So when we're talking about prolonged static posture, we're talking about anywhere within the 30 minutes time frame. So
I see.
Posture all the time, and exactly the same with sleeping as well. I mean, when people always ask me, "Oh, sleeping on the back, sleeping on the side," it doesn't matter, what position you're doing, as long as you keep changing the position.
Yeah, but how do you know you're changing position when you're asleep? I think that's the tricky part.
Some people move all the time when they're sleeping. Some people don't,
Yeah.
But as far as you can achieve, try to move from time to time.
Yeah, for sure. So what are your views on standing tables, standing desks? Because that's a huge trend at the moment. So people get rid of their chairs now and they're all at higher desk and standing desks. What are your thoughts on those?
Well, once again, we're talking about prolonged static posture. That is harmful. Even when you're standing, you can stand with poor posture. Say, for example, when you're standing, you can put weight on just one leg and then shifting your pelvis. So you've got lateral pelvic tilt. So you've got shortened muscle on one side, lengthened muscle on the other side. If you're standing like that, at the desk all day, crouching your shoulder forward, I don't think that is helping at all. Even though you're standing, the hip flexors are not tightened, but you've got lateral pelvic tilt there, which is causing as much harm as when you're sitting.
Right.
Different type of harm. So when you're talking about standing desks, you have to stand with proper posture, which is very, very difficult, especially when you're trying to work on the computer.
Yes, because your arms are forward, you're out of balance, and you're naturally leaning forward.
Yeah, so standing desk is better than sitting because your hip flexors are not tightened, but making sure that you're standing with both feet on the floor rather than shifting weight on one side.
Got it.
Have to shift weight on one side, make sure you shift weight onto the other side.
And to balance it out.
Every 15 minutes, after every 15 minutes. So you really have to count that out, because if you spend an hour with weight on that side, half an hour with weight on that side, over time, that can become extremely significant. That can perpetuate, muscle imbalances.
Yeah, 100%. If you're working 8-hour days, 9-hour days, over a period of several weeks, that's several hours. Yeah.
And you're talking about over the years as well, because postural problem doesn't manifest itself over 1 or 2 years. It manifests itself over maybe 10, 20 years. I mean, I've been doing this for a very, very long time, and I didn't actually get pain until sort of 10, 20 years into my career. But I was lecturing to a young group of dentists, they just qualified over 1 year. 98% of them got neck pain and back pain already. Yeah.
Wow.
Yeah, so
wow.
it's
Fascinating.
becoming more and more common and starting younger and younger. It used to be a sort of older people a problem, but now even young people get that.
Yeah. Do you think it's because they're looking at their phones all the time, so that you're naturally in that position? Yeah.
Standing is a very, very good thing, only if you're standing properly. But it is impossible to stand with two legs properly all the time. Impossible.
Yes.
Yeah.
Yeah.
So
Unless you're a
just,
soldier, maybe.
yeah, the main thing is to make sure that you change your posture all the time. Oh, when we're talking about military posture, you know, that is not a good posture because you're really hyperextending your spine like that.
Uh-huh.
That is excessive anterior pelvic tilt, excessive hyperextension of the back. So that is not proper posture at all.
Right.
Yeah.
Okay. Yeah, no, fascinating. That's fascinating. Well, those are really good tips there. And I just want to ask you a few more questions. That's okay. Now, we've talked a lot about the posture and remedies. You know, that you know a lot of people could do, especially the white collar professional that can do. I want to ask, you know, does nutrition come into play when we're talking about, you know, poor posture or you know, or things like that? I mean, does nutrition become a huge factor? I mean, a lot of people, I believe, and correct me if I'm wrong, particularly people who are overweight or obese, they tend to have more pressure on their spine and on their joints and sometimes their poor posture as well. So, do you believe, you know, nutrition has a big part of it? Big part in
Well,
it?
thank you for asking that question. In fact, you know, I actually missed out obesity as one of the causes of anterior pelvic tilt, because those people with abdominal obesity or those people who are pregnant, they shift the center of gravity forward, and as a result, they hyperextend the back. So nutrition does not really affect musculoskeletal pain or posture directly, but it has an indirect consequence. As you rightly say, you know, if you have a lot of unsaturated fat, a lot of unrefined carbohydrates, that will increase your fat retention. Also stress as well. I mean, if you are under a lot of stress, you know, cortisol, which is being produced over long term, can cause fat retention, and that can actually cause abdominal obesity as well in the long term. So although diet and nutrition will not have a direct effect with posture, it has an indirect effect.
Fascinating.
And nutrition is very important for your general overall well-being anyway. You know?
Yes, correct. Yeah, absolutely, absolutely. Well, that's great. Well, look, Dr. James Han, it's been a pleasure talking to you today, and I'm really interested in that book that you've written. And is that available for you know, the mass public to purchase?
I've written books actually. One especially for dentists. You know, this one is not really that suitable for the general public. This one here, this one here, called the people. Let me just
what does it
let
say?
me turn off the this one here.
Okay.
This one here, the practical guide to the self-management of lower back pain. This one is available from Amazon.
Okay, great.
Yeah, this one offer you a lot of tips, you know, on this management of trigger points, management of trigger points, exercises for obesity, and core stability exercises, and so on. You know, so it offers a full management protocol for lower back pain, and management of obesity is one of them. Because as I said, you know, obesity shift the center of gravity forward. That is one of the main causes of lower back pain as well.
Yeah, for sure. Great. All right. Well, we'll definitely, guys, definitely go get that book from Dr. James Tang. And so, if our audience want to get more of your content and want to watch more of your videos and follow you on Instagram, so where's the best place? How do they find you?
Oh, just subscribe to my channel on YouTube. You just search for James Tang Fitness on YouTube.
Yep, James Tang Fitness.
T-A-N-G Fitness on YouTube. If you have any question, you know, just drop me a message and I will answer your question free of charge.
Yeah, fantastic. Well, look, we'll definitely be posting a link on the bottom of the video, so making sure everybody can follow you. So what platforms are you on? So obviously you're on YouTube, you're on Instagram, are you on Facebook and LinkedIn as well?
I've got a business page, health addiction, personal training. I don't use Facebook that much, but all the posts that I post on Instagram, I post on Facebook as well.
Okay, great, fantastic. Well, look, thank you so much, James. It's been a pleasure, and I know you're a busy person, so I really appreciate you taking a time out of your busy schedule to have a chat. And look, love to catch up with you again in due course. But in the meantime, look, I'm going to go find a war and measure my posture straight away.
Excellent posture. I'm sure you got excellent posture. Well, thank you very much indeed for inviting me to talk.
No problems at all. It's a pleasure, and thank you so much.
My pleasure. Take care.
Catch up with you soon.
Bye-bye. Bye-bye.
Bye-bye.